Welcome back to the PFC Podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC Podcast. This is Dennis, and today I am with Mike. How are you doing tonight?
Very well, sir. How are you doing?
I'm doing well. So if you would, since this is the first time on our podcast, would you do a quick introduction of yourself?
Sure, absolutely. Several decades working, for the U.S. military, and most recently, since retirement, working for the School of Medicine for the University College Cork in Ireland, as well as taking on some consulting, some assistance, and some active contribution to humanitarian organizations over the last 4 years.
Nice. Very good. So, especially working for an actual university, you're absolutely going to be the perfect guy to talk to about this, because this is about education and essentially for a novice, how do we get this thing done, right? So that's kind of, since context is always so important, I get tasked. I'm going to an austere place. My task, and these people that are there are under duress, whether that be man-made or natural disaster. And I've been tasked with providing medical care and educating, augmenting their kind of medical infrastructure. So how do you even begin, right? It seems like it'd be easy, but how do I begin to even be successful?
Yeah, I think the first question, I joined an organization about a little bit over 20 years ago, and one of my mid-level leadership told me, he's like, whenever you get a problem in this organization, you ask yourself just a few questions, just 4 words. What is the requirement? That right there, upon really good critical analysis and a full understanding of what that requirement is, will always ensure your success and the success of this organization. So I've always tried to kind of use and glean from that at all times, no matter what the requirement was or whatever the analysis was. And I think, Dennis, it starts with asking yourself or asking your team or asking your organization, what is the requirement? What do you want me to do? How am I going to be successful? And I think that understanding, especially as a team, and having that plan is critical in moving forward from even just, letter A to letter B.
Yep, absolutely. Now, that would be super easy if that organization was just medical providers and we were all on the same page. Generally, whether that be governmental or NGO or whoever, it's generally a multidisciplinary team, a small component of that being medical. So having been in that kind of spot before, usually the answer is go do medical things, like take them outside and do like medical stuff. And then we're good with that. Like, what kind of questions do I need to ask other than, what does success look like? Because it's going to be like, they're better at medical things than before. And what does success look like? What other information, what other information do I need to get or ask?
Yeah, absolutely. And I think, again, that just comes down to that critical analysis. In my opinion, it begins with just finding a common language, right? And maybe that's with the nation that you're working with. Maybe that's with the operations elements or the chief of staff or whatever the humanitarian organization that you worked with, whether it's civilian or military, host nation and humanitarian. You want to always try to see things as they see them, because that's going to really enrich your understanding from the very beginning. And ask a lot of questions, hey, there are facts, and this is what I define facts are. I'm making an assumption here. We need to turn that assumption into a fact by interaction. Hey, what are my limitations, which are usually those things that, naturally, decrease our freedom of movement or our ability to do things. What can I do? What cannot I do? And then, what do you want me to do, or what do you think you want me to do? And let's validate that request. Let's validate it and make sure you fully understand medically what that means when it comes to money, time, effort, specialty, or whatever the case may be. So yeah, I absolutely agree with you. This is far more complex a question than I would have considered, 20 or 25 years ago. And I hope that's one thing that we can kind of, pass on. Another thing is just, to understand the environment that you're going into, basic understandings. What's the structure? What's the scope? What are their understandings? I have been working in Europe a great deal over the last 7 years, and I can tell you that every single nation in Europe has different medical ethics. They have different medical laws. They have different medical scopes of practice. They have different medical practitioners. So every single time we engage or interact with a nation in Europe, our allies, we have to look at it differently for every single nation. It makes it a little bit challenging, but it also makes it a heck of a lot of fun and really, really interesting, because there's a lot there that you can learn from yourselves. And even going to third world countries or second world countries, I think we have a lot to learn there too as well. So that engagement, that common language, that understanding, and that critical analysis at the beginning is absolutely essential to even taking the first step. Just to go on, a little bit is, there are different ways of doing analysis, 100 different ways, whether it's organizational, whether it's government, whether it's intuitive. There are different methods of analysis, business analysis or engineering analysis, or even psychological analysis. For the layperson, if they don't have a really good structure, the old traditional SWOT analysis works real well. What are the strengths? What are the weaknesses? What are my opportunities? And what are my threats? And threats isn't always, life-threatening or risk-taking. Sometimes my threats are unlimited, and the amount of room I'm able to teach and educate people in. I'm limited in the amount of really high-quality instructors or specialists that I can bring in, the expertise that I can bring in to make an impact. So, that, again, all that task analysis goes into that, and kind of just understanding what the requirement is, using a good process in which to do analysis, and then getting that research done. And that research, again, always starts from big picture, and it just kind of gets to small picture. And in that big picture, I think, honestly, that we are more enabled personally now than we ever have been in our history, not just because of computers and technology and the internet and everything, but just by the validity, the merit in the medical information and intelligence that's out there. And just to set a common language between us, medical information is just medical information, but it's not interpreted. It's not analyzed. It's not usable for your specific requirement. And it's not validated. So that's information. Intelligence is just the opposite of all those things. It's validated. It has merit. It's applicable to your use. It's not generalized. It is specific. So, thinking about our sources of information and how we kind of track those down, anything that we can find on the internet now is actually pretty good, and people just very, very often, in my experience, you say, hey, look at the World Health Organization or look for the Center of Disease Control. And they're like, yeah. But that's not right. The WHO and the CDC are just two of the very first, very big actors in this realm. And you could probably find 98% of all your required information just from those two assets. And just looking at some of the other, opportunities to find medical intelligence out there, the European Center for Disease Prevention and Control, or any regional Center for Disease Prevention and Control, whether it be Indo-Pacific, whether it be in Asia, whether it be in Europe or in Africa, that information coming from where you are going to fulfill a requirement is probably the most valuable. In North America or in South America, or coming from across a great ocean, we don't always have the understanding of malaria or flora and fauna or what the disease processes are there. So go to where the sources of information are and use those to your best benefit. Some other great ones. There are pay sites too as well, whether it be TravX or Blue Dot or International SLS. You can pay for the information, and it's going to be really good information. You have to be really critical on how up to date it might be. And again, that's where some of your bigger actors, such as the World Health Organization and the CDC, are up to date. They're constant. They have concerted efforts on maintaining that information. Again, we talked a little bit about big picture to small picture, and that might not just be medical. Maybe it's just cultural or national. Some of the other places I look to, and I try to recommend people going to, is, so for better or for worse, there is corruption in many other nations. And one of the most specific targets for corruption is medical care, because medical care is augmented a great deal from outside their countries or by benefactors or by nonprofits, such as Bill and Melinda Gates, and they're going to take advantage of that. So look at your transparency of International Corruption Index, and that's kept up always to kind of understand about what your risk, back to that SWOT analysis, is in that respect. How do you understand them globally? Global Edge, now it takes a very business approach, but it does look at every single country culturally, whether it be in finance, whether it be in government, whether it be ethnicity or religion, or just what their national culture is for their area of the world throughout their history. Global Edge will give you some really good perspective on that. So again, it's going from that big picture analysis to small picture analysis, but hopefully those are some really good, very valid and very of high merit sources of information that we can begin with.
No, very wise. Just use every resource you possibly can. All that groundwork laid before you actually step onto the ground is definitely going to pay off. One of the things you were mentioning is getting that common ground. Usually these things are arranged at generally a higher level. That could be, some kind of Ministry of Health, something like that, a more governmental, a legal level. How far down the chain do you want to try and get, if that makes any sense? Like, the Minister of Health may say, yes, you can go ahead and do whatever it is I want you to do. But I get down to, the clinic, and the provider there has a very specific personality, and he doesn't necessarily like anybody messing around in his little house there. How far down, because you obviously, you want to build a relationship and not screw things up for the next group of people to come beforehand. Like, I guess, how do I even begin tracking that stuff down? You know what I mean?
Yes, sir. And again, one of the first steps in your analysis is just understanding the environment, and I think a great piece to that is you dovetailed it right in there, Dennis, is friends and partners, right? I think friends and partners are absolutely two different things, and to be critical in that aspect. And when I say be critical, don't be judgmental, but look at it in a very black and white business sense or an executive sense. But you look at friends and partners. Partners are basically those that are working with you. Yeah. Sometimes they're directed to work with you, right? Sometimes it's for advantage and it's for their profit to work with you, right? Sometimes it's political, that they work with you. So keeping that in mind, again, trying to see the world through their eyes and understanding that will give you a great advantage, a very uncommunicated advantage. We talked about partners and friends. Friends are those who will always work with you. They have an altruistic intent. Maybe you've shared past experiences, or maybe you just share the same values and culture, So I think that's a great start point to your question, how far down the line it goes. And whenever I hear a question about that, especially when it comes to mission analysis or task analysis, I always say it depends. Right? That's the lawyer term, right? Hey, can I do this? Well, it depends. I think it's very true for us too. When we do medical task analysis, it depends. How far down the line can I go? It depends. It depends on what your impact is. It depends on what the intent is. It depends on what your scope is. It depends on what their scope is, So again, a lot of very specific critical analysis going on here. But those are some really good points to start with. And in that respect, we spoke a little bit earlier about going from big picture to small picture. But there's a kind of an adage we always use, like 80% of your success is in planning and preparation. 80% of your success is in planning and preparation. Medical, by our culture, by our personality, is 90% of the time reactive. I mean, that's just the way our profession and our community is. Whenever we do something like this, we have to be the total opposite of that, right? We have to look at it, from the operations point of view, from the COO's point of view, and how we do that stuff. We can always certainly fall back on kind of a similar in parallel adage of your 6 Ps, right? Proper prior planning prevents poor performance, and that's a little less colorful than the 7 Ps. But it is really critical here, And you're just asking yourself your basic questions. Again, going back to that, what is the requirement? What do I know? What do I think I know? What do I need to know? What do I really know? Asking yourself those questions and being honest with yourself that there are things that you're not going to understand. Again, a principle, assessment. Whether before you start the training or before you go to a country or before you provide disaster relief, 80% of your success is in preparation and planning, and that's the assessment piece, right? And even during the assessment piece, you can look, hey, how do I set the conditions for my success when we get there? What can I do now to make me more successful later? Whether that's reaching out to people digitally or on LinkedIn, or whether it's doing that internet searches and understanding just exactly getting a better understanding of the environment and the structure. I've seen some pretty creative things on this. I won't lie to you. I worked with a corporation for a little bit, and as I said, there are some really capable medical intelligence corporations out there. And I worked for one just a little bit after I retired, and I had analysts, medical information analysts, who worked for me. And I was quite impressed, to be quite honest with you, because especially when we were looking at resource-limited environments, humanitarian or disaster environments, or even just the most austere third world environments, or those failed nations such as Somalia, they would rely on the health or the World Health Organization, those young analysts, but then they take it a step further, right? They look at a facility that's within proximity of where we're doing our work, and then they start to go to the departments, and then from the departments they would go to the doctors, and then from the doctors they would go to the social media. What's the social media impact, and what's the feedback on this doctor or on this office or on this bureaucracy? And it really gave us some great insight on how to understand the environment before we even got there. And that was something I never would have had the imagination or the understanding and the use of technology and social media to appreciate in order to execute that. So they taught me a great bit there, but it was just another opportunity that you can take advantage of in this day and age, on to better set yourself up for success later.
Yeah, absolutely. Because as much as governmental organizations have the most access to at least their own countries, generally there's going to be some kind of spin. And just like social media, there's going to be a spin. So everything you have to take in with a grain of salt. However, if the tide is generally going one direction universally, it's like, I think things are going this way, versus what, maybe the face somebody's trying to put on what's actually going on,
Absolutely. Yeah. And as well as I do throughout your travels and your work, body language,
yep,
cultural interpretation, all of those things come into play. And again, you and I live in North America, and we're protected by these two great oceans, which also isolates us from the rest of the world. And having a fuller understanding of that from, say, someone who lived in Switzerland, we're disabled in that respect, and we have to understand that disability and try to see that as a risk and try to enable that and grow above and well beyond it, sir.
Yep, absolutely. So going beyond my, mission analysis, okay, now I've kind of formulated a plan, okay? Fully knowing that as soon as you hit the ground, your plan is probably going to be wrong, but at least we have a general direction. How am I going to be best successful, getting these students of whatever level they're going to be doing whatever we're going to be doing. An example, in the military, I receive students, I can yell at them, I can do essentially whatever I'd like, and they have absolutely no choice but to sit there and smile. However, you're invited into another country, you're given a group of students with a certain outcome, that tactic probably is not going to work that well, right? So, just starting off and maybe, and again, like you mentioned, that mission analysis, that cultural analysis, understanding how they communicate with each other, I think would augment that. But what I won't say techniques, but what maybe general advice would you give me coming in?
Yeah, I think your question, Dennis, transition us in a beautiful place. We've spoken about principles up to this point, but now we're going to start talking about process, and how do I execute this plan? How do I execute the process of fulfilling this requirement? And I think, I think the first off is just enabling yourself, making sure that you have the right specialties to meet the requirement that you have, right? Perfecting the basics, at the end of the day, being able to stop bleeding is far more important than understanding ABGs, right? So I think being able to perfect those basics for that requirement is really important. And that even goes to knowledge, and just to step back and use an old quote, knowledge is as education, but wisdom is experience. But you have to start with that knowledge. I think a basic understanding of Bloom's taxonomy is a prerequisite for any educational effort, no matter if it's reactive or proactive. And I think just understanding that concept in human interaction and human growth is really critical. For me, I'm kind of a caveman, so I try to keep it real simple. And very often, me and my colleagues at the university will learn or will use Jane Vella. She wrote a book, Learning to Listen and Listening to Teach. And it's well known throughout the medical educational community or any educational community. And what's great about this method or this process is that it works on almost all cultures, right? She was a teacher of multiple cultures, so it's multicultural approach. It's proven, right? It's proven over time and by measurement. It's a very simple application, right? It uses very intuitive processes on which to come up with a plan and then execute that plan and then measure that plan at the end, and then assess it in the first hand, right? The last great thing about the ADDIE technique or by Jane Vella is it's focused on the learner, not the teacher. And very, very often, even in the Ivy League schools of, the United States or across the world, very often it comes down to the professor or the instructor instead of the student. And this technique really looks at the student and what they want, what they need, and how they're going to get it. And again, like I said, very intuitive. It's basically, the first 8 steps start with your 5 W's, right? It's who, right? Who am I teaching? How many of them are there? What's their profile, religious, ethnic, cultural? What do they already know? Am I teaching nurses or am I teaching medics or paramedics? If I'm teaching nurses, so what? So what does that mean to me? Are nurses in every country equal? They're not. It's absolutely the truth. So you need to understand that dynamic, right? What do they want to know versus what do they need to know? You spoke of kind of a hierarchy of medical engagement and education execution. A lot of people, to include ministries of health, think they want something, but do you really need that? Let us validate that requirement for you. Do you have this? Are you going to be able to sustain this? Or, what type of logistics do you have to support that? If you don't have all those prerequisites, then you're pursuing this in vain, right? So understanding what they think they want versus what they actually need and being able to validate that is really critical in that step one of who, right? And again, I said before, assessment. It's all about assessment, and that engagement with the who of the ADDIE technique or Jane Bella is where you get that assessment. Again, back to the 5 W's. Why? Why is this training called for, right? Why do they want it? Why are we giving up our time or our money, our budget, the people who contribute to our organization? Why are we giving it to them? So understanding that, again, goes to a really important aspect of any plan, and that's purpose, right? The purpose for the student and the purpose for the instructor. Purpose is what gives us our initiative. It's what gives us our synergy. It's what gives us, a reason for being there. So that kind of all falls into the why piece in this process. When? What time of day are they training? What days are they training? How many tea breaks do they have to take in a single day? It's usually at least 2, especially for the colonial nations, or, those that have evolved out of colonial status. Length of sessions. How long can they work without taking a break? How much attention span do they have for a hands-on? How much attention span do they have for a didactic? And you might get that from people who are already there in country, humanitarians, government officials. A great resource is college students that are exchange students or medical students in each country. Draw them from the universities of your own country in order to make an impact on the country that you're entering to, right? How much time do I have to prepare? How much time do they need to prepare? What cultural or religious or national respects that I have to have when we're talking about when training is being executed, for how long training is being executed. Again, still in the 5 W's, where, right? What's my site for training? How accessible is it? Is it secure? Do I have the basic requirements for existence and water, restrooms, lighting, constant power? Do I have the facilities, the proper facilities to support large group discussions? Do I have the proper facilities to support small group discussions? You can't put 3 or 4 small groups into a gym and expect them to reach the optimum level of education because it's echoing. It's just not the proper environment for them to do that. Lighting and sound come into that too as well. Again, what now? We're down to number 5. What is the content of the course? And is it relative? Have I done my job in bringing not only the specialties and the experts that can give them that information, but more importantly, can those experts actually communicate that information? Very, very often I will see the greatest medical experts, the greatest medical researchers in the world that just have difficulty conveying a thought in English to an English, community or audience. Now you take them into a third world country and, they've gone from 0 to 10 on the stress level, and translators and interpreters cannot keep up with them, So have I properly, prepared that tool to have the impact that I need it to have, kind of under the what context of this, right? And this is all informed basically, I think, by your assessment. Again, assessment, right? We talked a little bit before about purpose, and number 6 in the Jane Bella technique is what for, right? What are the learners going to do with this? More importantly, what is the impact, right? What am I changing? How am I improving the world? How am I improving these medical providers? How am I improving medical care? And that's really important. And I will tell you, in my life, didn't really appreciate that to the context that I should have. And in your younger years, you just want to execute. You want to make a difference. You want to engage people. But at the end of the day, are you doing the best thing that you can do to have the best long-term outcome and make these people autonomous and self-sustaining? Or are you making them more dependent on us or humanitarian efforts? And Dennis, you kind of referred to that earlier in the podcast. So I think that's really important to kind of keep that in mind. Your outcomes, specific and measurable. In type A aggressive personalities, I'd like to think I've been around them for quite a long time of my life. And towards my later years, I said, stop, write a list. I don't want to see what your successes are. I want you to see what your successes are. Because very, very often, all we see type A aggressives, hey, what do I need to do? Not really what have I done? And they need to see that. They need to see it specifically, and then you see it measurably. And it's good for them, and it's good for the audience too. The what for pieces, the measurable pieces also have to be obtainable, right? They have to be reachable, right? They have to be reasonable and feasible. Can I do this with the equipment that I have? Can I attain this level of proficiency with the time that I have, right? And one thing I always say, even if you think you've done your assessment to 100% and you think you've really engaged them, you've done your research, always take just a step back, be realistic, under promise and over deliver. Because there are unknowns out there. There are intangibles. There are things outside your control that are going to affect your ability to perform your job and perform it to the level that you want to, and then measure it in the way that's needed. So under promise and over deliver. And that will always set you up for success, and it will never negate or put you on that flying carpet that you're going to fall off of at any time. How? What's my organization? What are my learning tasks, right? What are my materials needed? This is a little bit the devil's in the details, and it really is. It's always the devil's in the details. But by this time in this process, this very valid, very proven process, by this time you've gotten all that stuff. You've understood it, right? So now I need to get the devil in the details, and I need to put my monies towards my budgets and towards my logistics, securing my time, doing my administration, doing my coordination. Because all of those enabling functions are no different than a corporate business or a humanitarian organization or a military unit or command. So that how piece is really critical. And then the last thing, it's the so what piece. So what? So what does it mean that I'm doing this training? What's my learning? What's my transfer? What's my impact, right? Why measure it? Why? Because we owe it to ourselves. Any educator or any line of effort in education or reaction to a humanitarian disaster, we need to measure if we succeeded or not. I think we owe it to ourselves. I think we owe it to our audience. And I think we owe it to our futures, right? Did we meet the objectives that we validated or that we were directed to, right? Then the last thing, and why measure it, is to kind of guide our future interactions and our future efforts and make us better. In measuring outcomes, or the so what piece, there are two things. And to be quite honest with you, again, these are another two measurements that I wish I had understood about 20 years ago, because it would have made me far more effective far earlier in my life. Measures of performance and measures of effectiveness, MOPs and MOEs. This is a business financial measurement and metric, but it's very, very effective for us. It's very effective for us individually, but more importantly, the people that we work for, right? If we can give these measures of performance and measures of effectiveness, then the executive decision makers, the philanthropists, they're going to get a lot more out of this. It's going to be money to them at the executive level. Real quick is as briefly as I can explain these measures of performance, these are quantifiable, Dennis. These are the numbers, right? These are the numbers that we're going to see on the screen. How many people did we train, right? How many people a day? How many providers did I interact with? How many national providers contributed or participated? How fast did I get the training done? What budget did I spend on the training, right? How much is achieved? It's all of your numbers, right? It's a measurement of how well the systems of elements were accomplished, right? And it kind of gives us a snapshot picture, that very tangible, clear, black and white outcome of how well we did something, and some other examples, like I said, the number of people taught, right? The number of patients seen, what was our cost sharing, right? How many villages have we participated, contributed to, visited, engaged? How many groups or how many actors were involved in planning, whether it be local government, local health officials, local police, non-governmental organizations? What agencies or political agencies or governmental agencies, right, not only participated, but more importantly, remained until completion of the event, right? That proves their contribution and their stewardship, and their investment as well. So again, it goes back to percentages and numbers, and actually quantifiable numbers when we're talking about measures of performance. The second piece, not so clear, not so measurable, but just as important, are measures of effectiveness, or MOEs, right? This is a measure of impact, or an impact assessment within a certain context, right? And here, no matter what language it is, we're using adverbs and adjectives to kind of describe what our measure of effectiveness is. And measures of effectiveness are not always immediate, right? We can't always find those at the end of a trip into a nation, at the end of a relief and disaster mission, or at the end of a military engagement, right? Maybe it comes with time and perspective and feedback, right? Again, going back to adverbs and adjectives, right? How do we do the right things? Again, what nation health systems were enhanced, not how many. What national providers gained access to their population, and how did we enable that to continue in the future, right? What medical infrastructure did we have impact on, okay? And some of these, again, I said this is a measurement within context or criteria, right? So let's just talk about medical, right? If we're talking about medical graduates or medical students, they share knowledges with their villages, because we know in third world countries or real difficult types of environments, you're going to want to take those medical students, expose them to their own nation, and then have them invest in their own nation and kind of understand their nation. So how do those graduates share knowledge or invest in their own villages and nations, right? How do the villagers continue to access the care through their own Ministry of Health of their nation, right? Another context might be information operations or public affairs messages. What type of positive message was delivered to the population, right? Did we ensure that there were no negative or adverse effects? And if there were, how do we mitigate those, or how do we solve those, right? Access, a great problem, even in the United States. It's a clear issue in places like Alaska or Texas, and that's access to medical care, right? How does access to medical care, how did we obtain access, medical access, into the areas of interest that we were supporting, right? How do we have medical infrastructure engage the most local politicians or village leadership, right? All politics is local. So how did we enhance that? How do we ensure the engagement? How did we assist in that continuing through time? So, again, just going back to process a little bit as we talked, principles prior and going into process. Again, there are many processes of teaching, many process of educational impact. But we very often use Jane Vella's learning to listen, learning to teach. And again, those 8 steps in her process probably, I would argue, give you an 85% to 95% guarantee of success. And to me, that's a pretty effective process. So in just kind of expand it a little bit with measures of performance and measures of effectiveness, because at the end of the day, the world's shrinking. Communities are integrating. Geopolitics, whether we like that they impact medical care or that we don't like that they impact medical care, they impact medical care. It's just a truth. That's a fact. So all the communities, we're starting to see them engage a lot more. If you go to an OCHO meeting for the World Health Organization, you will literally see government representatives and uniformed military officers in there from other nations, because there's no choice anymore. That's just the reality of the world. So understanding, maybe appreciating more of the big picture, I think will help those that are doing the person-to-person engagement and making pain go away and teaching other people to make pain go away, will enable them a great deal more.
No, it's always wise. I think that's a really great plan. Just from having been teaching people for quite a while, maybe at a much smaller level, check your ego at the door. Like, do not bring that classic American, like, thank God I'm here, right?
Yeah, sure.
And
don't worry, I'm here.
Yeah, everything's fine.
Yeah,
the Americans are here. Oh,
yes,
by
sir.
the way, here, I'm going to buy you a CAT scan. Check your ego at the door. It's assumed if you're going to be teaching, somebody picked you. The students are going to assume that you probably know more about whatever it is you're going to say than they do. It's okay. Just deliver the information so that it's the student that matters, And when I started teaching, I learned this lesson over time, because in my youth, I was a bit more angry. And so I essentially gave people, 2 barrels to the face until I finally realized it has nothing to do with me, it has everything to do with the student. Those people they're here because they want to do something, right? Give them the information that they need. Give them the experience, your lessons learned. Give it to them so that they don't have to go through the same pain.
All right, 100%. And I think that daily interaction, hey, are you happy with what you got today? Is there anything, that immediate feedback, right? That assessment, that continuing assessment. What do you need tomorrow? Is there anything you didn't understand? What do I need to better understand you? Is just going to give you that continual climb in effectiveness. Even if you've done everything prior to that absolutely correctly, that continued interaction, that communication, that courtesy, that respect. I agree with you. Too often, first worlders or Americans in particular have this, savior complex that does nothing but just absolutely takes away from them. And it's actually, I think, quite healthy for us to go into some areas and be humbled, because I think we need to be humbled. I during my military service, we did some work in Bangladesh, and we worked with about 30 of their soldiers and some of their medical care providers. And I can tell you right now, all of their soldiers could do math better than any American. So we by far, kind of overestimated just where our impact was going to be in that respect. So we took a dose of humility like we should have.
Right. Nothing to say anything bad about the Marine Corps, but I'm just pointing that out. And another, I think, very important rule is knowing, like, what is it at the end of the day, at the end of the training, at the end of the cycle, whatever it is, what is it you want them to do? If it's something like, I want them to know data and statistics, make a video and send it to them on YouTube. Don't even bother showing up. If we're doing an in-person class, I want you to do something. Have that as your goal, and everything back plan off of that, because I've seen it time and time again, and it kind of goes with that ego thing. I want to prove to you how smart I am. So I'm going to blow your head off with data and statistics and suck up your time to actually do. So, and we build classes that way. So
I agree with you. Yes,
yeah.
sir.
Let's focus on what is it you want.
Yeah, absolutely. Yeah, and I think too, the entire community, no matter what sphere you work in, are kind of like, I think we need to get back to perfecting the basics a little bit better. You know, what do I need to do? Because that's what I should be doing the very, very best, you know? And I think that's real healthy for us. And on your point there, especially with, statistics and the methods of actually teaching, I still communicate, work with, and support, 3 humanitarian organizations. And okay, February 2022, there was an emotional release there, the invasion of Ukraine. And, probably for the first 6 or 8 weeks, did not know if the Russians were going to really progress through Kiev or not. So, of course, a lot of effort, a lot of emotion, a lot of bang going into support for Ukraine in a medical sense. By the end of 2022, it was like, hey, slow down just a second. I mean, this is stabilized, okay? What can we affect and impact in country, and what can we affect and impact to the same level outside of country, right? Whether it be virtual, whether it be data sharing, whether it be literature sharing, whether it be train to trainer, we had the ability to do it now outside of the country. So why put people at harm? Why put undue administrative requirements on the Ukrainian government and the Ministry of Health? Why do all that unless we absolutely have to? Again, assessment, and assessment.
Yep, absolutely. And that perfect example, the invasion of Ukraine, something happens. You're on the ground. Everything was going to plan. And then something happens. And now my goal, they've shifted the goalpost on me, right? Either I gave you 3 weeks and now I give you 1. Or, we had this much money and now we have this much money. Or, whatever the example is, there's a new danger out there. I have to shift fire. How can I do this in an efficient way to still get them what they want? Maybe even if it's a completely new requirement, in the time, allotted me. Like, this is going to be a quick shift fire. How can is there a methodology to that?
Yeah, I agree with you. And I think it's that redundancy, right? Having a redundancy of platforms or a redundancy of efforts, because as we mentioned before, there are a lot of unknowns. There are a lot of uncontrols. Yeah. There's a lot of unexpected impact. There might be conditions to the environment that immediately stop what you're able to do, whether it be loss of power, loss of water, a natural disaster, or earthquake, or whatever. But having redundant methodologies using the same processes, I think, is really critical. Having your first plan, your second plan, your third plan, your fourth plan. When one goes wrong, you're able to immediately transition very, very quickly to the second plan, A, B, C, or D, And I think if you look at those plans, based on not criteria so much, but basically subjects, right? In a real quick analogy here is medical care, right? Who's the first guy that's going to treat this guy? And then what's my evacuation plan? And to what hospital? And then how long is it going to take me to get there? If you put that in line 1, line 2, line 3, and line 4, you don't really have just 4 plans there. If you took each one of those subjects, each one of those 4 subjects with 4 lines, you've got basically 32 or more options there. It's a matrix of options instead of linear plans, And I think if you look at it that way, Dennis, just as you alluded to, it's going to give you a lot more flexibility. And no matter how much the conditions change, you've got an answer for it, right? You've got a solution to that problem. And you will get, in that flexibility in thinking and flexibility in execution, I think that's one thing where I think we have strengths in, and I like the I'd like to hope that all of the younger medical officers and medical operations executives, hospital administrators are thinking in those senses, because with a multi-domain, multi-dimensional risks that come nowadays in our world due to technology, we have no other choice.
Yep, absolutely. As we're closing things up, is there any last minute advice for me going downrange?
Yeah, I just real quick threw some closing remarks here, and I think
Sure.
I think I'm just gonna, if it's worth repeating, there's a reason for that. Assessment, and assessment. I'd never assume anything, right? Ask yourself those 4 words. What is the requirement? And be analytical on whether it's real or not and how you have to do that, right? Think about under-promising and over-delivering, and I think that will always keep you out of trouble a great deal, especially when it comes to perspective and perception. Planning, 80% of your success is in planning and preparation. And planning has a lot of inherent benefit to it, in my opinion, especially for a manager of people, for people themselves, or for leadership. You're in a situation in a bad place. For an example, right? I have been in a situation where I was in a bad place, and when I arrived, the information was not as we had been told. Our support was not as we had been told. And the schedule was not as we had been told. And in this specific instance, we were able to say no. We said, no, we're stopping right now. We're analyzing and we're making our own plan. Give us 24 hours and we'll give you a go or no go. As a team, to include the leadership that were outside our country, we evaluated the situation. We obtained all the necessary information, and we all made a plan that we agreed and contributed to. And then we did it. And I think having that purpose, having that stewardship, having that investment is how you accomplish good things in really, really difficult places. Planning gives you understanding. Planning gives you confidence. Planning gives you comfort. And planning gives you purpose. And that purpose is really, really important to the medical provider.
Yep, absolutely. Thank you, Mike. I really appreciate you coming on.
Thank you, sir. It's been a pleasure and quite enjoyable.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC Podcast, out.